Hello, welcome to Vital Signs Podcast. This is William Hatton with West Texas VA Healthcare System. I'm joined by Kelli Settles, not Stoley, because Kelli Stoley is here in the office with me. But Kelli, thank you for joining us today.
Absolutely, thank you.
You've been on before, and we couldn't help but bring you back. So
Sure.
We're excited to have you. We're here to talk about PTSD, kind of an important topic within the VA. I kind of want to, just jump right in. Why do you feel a whole month is kind of dedicated towards PTSD?
Well, I think, over the last several years, a lot more attention has been brought to recognize signs and symptoms of PTSD. It's estimated that at least 20% of combat vets come back and they have some symptoms, of PTSD. One of the things, too, is important to know. It's not just all about combat. You can have
Sure.
PTSD from any traumatic event in your life, going through a disaster. We just had Snowvid. That was
Yeah.
a little traumatic. So,
it
there's
was
lots
a little
of
traumatic for me.
people without power and electricity, So,
Yeah.
yes. So really, the VA just does an amazing job at highlighting really important topics.
Mhm.
And this is one. And our behavioral health service, we deal with and manage PTSD every day. But it's just very good to highlight the month and really try to get more awareness out there.
Awesome. So we have a special piece from Dr. Caldwell. Why don't you kind of tell me a little bit about Dr. Caldwell and maybe kind of jump into his little segment?
Absolutely. So Dr. Caldwell is our ACOS, Associate Chief of Staff of Behavioral Health. He is not new to West Texas, even though he's new to this role.
Okay.
He's been a psychologist with us for at least 2 years that I know of, and he's recently accepted the job as the ACOS of the service.
Awesome.
So we're really excited. We've been working really hard to bring in services and really have opportunity now to really engage providers that we had trouble recruiting in the past. And so
Awesome.
he's done a very good job of that. We've actually brought on 7 new psychologists in FY21.
Great.
It's been great.
All right. Well, Dr. Caldwell was so kind to record a little piece about PTSD and the importance of his role and what he's doing. So we're gonna take a little break. Here's Dr. Caldwell, and when we're back, we'll kind of continue the discussion of PTSD.
The behavioral health service at the West Texas VA is really prioritizing the delivery of evidence-based psychotherapies, or EBPs for short, to our veterans. Evidence-based psychotherapies really refer to specific psychotherapeutic treatments that have been well studied. These treatments have consistently been shown in clinical research to be effective in treating mental or behavioral health conditions. These treatments really are the gold standard for treating PTSD, depression, substance use difficulties, as well as other behavioral health conditions. These treatments focus on making specific and meaningful changes in the lives of our veterans to include improving their overall functioning, as well as significantly reducing symptoms associated with these conditions. It's useful for both our veterans as well as staff, including providers who refer veterans to us, to understand how EBPs can differ from more traditional ongoing talk therapy. Some of these differences include EBPs being time limited, usually lasting between approximately 8 to 15 sessions. Another key difference is that veterans meet with their therapist on a weekly or near weekly basis. This is very important. EBPs really are about building momentum. So it's really difficult to do that if a veteran is coming in once a month or once every couple months. That usually becomes more of a check-in, review of what's going on, talking it through, and then again meeting again in the future. But with EBPs, we're going up against some pretty significant symptoms. So to effectively treat and reduce those symptoms, you really need that momentum. You need those higher frequency visits. Another key difference can include EBPs really involving a specific review of progress to include changes in symptoms from week to week, as well as movement towards goals that have been ideally collaboratively identified between the provider and the veteran. Another key difference includes EBPs really including between session assignments and activities. This is also a very important point. Sometimes we think of therapy as being something that happens in the room between the veteran and the therapist. I personally have liked to refer to that as more of the kind of planning and review station. A lot of the real work, if you will, involves what happens outside of that room. So with the veteran having very specific things to do outside the room between those sessions, and then bring that back in to the room to review, to talk about how it went, to make changes based on that information, allows this sort of treatment to be much more effective. So again, therapy isn't just what happens in the room, it's really around the clock, and that's really what helps our veterans to reduce some of these symptoms, some of which, of course, are very significant. So really within our service, to enhance our delivery of EBPs to our veterans, we've done a number of things in recent months. I've prioritized the hiring of staff who are VA certified to deliver these very specific treatments. Something else we've done is we've created a new EBP clinic, which is staffed with remote providers who can deliver EBPs to our veterans via VA Video Connect or VVC. This, of course, is very important. Being in rural West Texas, we want to make sure that we're not only delivering effective treatment, but we can bring that treatment to our veterans, that they're not having to travel, at great lengths to try and receive that type of care. Especially if we're talking about weekly sessions, of course, that can be very difficult. Something else we've done is we've implemented a new intake clinic, which better allows our veterans to really have an equal opportunity, if you will, to be able to meet with an intake coordinator, go through a comprehensive evaluation to discuss, their symptoms, talk about their goals, and really identify their treatment preferences and needs. And really the result of that process is to kind of go through a menu of options, which certainly includes EBPs, and together with the veteran, process that's referred to as shared decision making, identify what might be the most effective treatment or treatments within our service at that particular point in time. So of course, this is something, for our veterans across the board, certainly our veterans who are experiencing symptoms related to PTSD, this is our main goal, to give them the opportunity to really receive the best from the best. So this is a focus that we have and something that we will continue to do moving forward.
All right. Well, thank you so much, Dr. Caldwell, for joining us and providing such great insight. I feel like right away, the things that I really took away from what he was saying was treatment can't be over a long period, in terms of sessions need to be short. You can't just have, 3, 4, 5 weeks in between, right? You have to have that consistent one-on-one. Why do you think that's important?
Well, just to reiterate what he said about building momentum, when we initially have that first appointment with a provider, we are establishing a plan of care at that time, right? And so we're building on goals and really want to know what is the goal of you coming to treatment. And when that's established, and then if you had to wait 2 or 3 months to be seen next time, in between, life happens.
Sure.
And so I think it's very important to highlight what he said about, therapy is about what goes on outside of your session and how are you coping and in the real world. and within your family, within your job, how are you managing symptoms? And so I think that is where the EBPs are so powerful, because every week you're checking in with that clinician, with your provider. You've built a relationship, now there's trust, you're doing your homework or your assignments, outside of the therapy time, but you're coming in and you can see progress. So it keeps the veteran engaged, and it also just makes for true healing, if you will, from the symptoms, and being able to cope. So, yeah.
So when a veteran is feeling, a certain level of anxiety or struggle, and they're going to these sessions, it seems like there's such an importance when it comes to what takes place or what goes on outside of the actual session, like between sessions. I thought that was just really, really fascinating to think about when you're talking about PTSD and trying to find solutions. You, as a veteran, have to take the actions to find help outside of the counseling, outside of the session. It's not just simply sitting and answering a few questions and feeling like you're going to find solutions. What does that mean to you in terms of that in between sessions?
Right. So once a veteran, voices that they need care, or they voice that they're having symptoms, they've already taken that first step, right? That's sometimes very hard for people to even recognize. Like, we don't associate maybe poor sleep habits, or feeling anxious all the time, feeling just numb, or being maybe secluded from your family, pulling away from the ones that you love. Sometimes that's hard to recognize as maybe PTSD symptoms. But once they have taken that step to engage in care, it's just so important that the ownership is on the patient, and that they know, okay, if I do these things in between, these are the things, the tools that I'm going to be able to use in my everyday life to, eliminate the symptoms that I'm having. So I think that's probably the biggest takeaway from it, is actually giving people resources to walk every day in life and reduce the way they feel about, or having certain symptoms. So,
for any veterans out there that haven't taken that first step, like you say, what kind of encouragement, or what would you say to somebody who is kind of on the fence about seeking out help for PTSD, or just outright is kind of stubborn and doesn't want to find help?
Sure. Well, I think it's just important to know that the VA, we truly have a desire to help and to treat. We want that trust of the patient. So I would say, give us a try. If maybe you received care years ago, things have changed. We are using technology. We are doing our best to deliver care where our patients are, instead of having them travel, instead of having them take off days of work and, all those things. And so give us a shot. We will partner with you. We will help you. We will do our very best to,
Well, awesome. Sure. That's to me, that's what needs to be said in terms of, like, as somebody who is an Army veteran and does have PTSD, I took that first step. Sure. I didn't want to at first,
right?
But in coming forward and finding progress in the things that I've been able to do over a period of time with different programs, speaking with people, I've been able to find and establish kind of consistency in my life that I didn't feel like I had beforehand. So sure. I would recommend any veteran out there who is in that same camp that just feels like life just isn't as stable as it should be, or it doesn't feel like it is, or you're constantly biting back at your wife, little things blow up, those incidences don't have to be the commonplace, don't have to be the consistency. And so I encourage anybody out there that if you're really struggling with something, as hard as it may be to take that first step, it makes the biggest difference. And so I encourage anybody out there to really, move forward with your life. And it really is a positive experience. So yeah. I want to say I'm so thankful for Dr. Caldwell for joining us, and Kelli, thank you so much for coming in and sure. helping us kind of shine some light on, PTSD, and be able to try to share this message with our community. This has been Vital Signs Podcast. I'm William, and this is Kelli. Thank you again, and we'll see you next month.